Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving. Today we're talking with Misti Bowers, Director of Hamilton Hospice. In this episode, we're going to explore when it's the right time to consider hospice care and take a closer look at some common myths and misconceptions about hospice. Misti, welcome to the show.
Thank you so much for having me. I'm happy to be here to talk about some of these myths and answer some important questions about hospice care.
Well, let's just jump right in because we have some questions for you. When might be the time to consider hospice care?
So it could be the right time to consider hospice care when we are at a late stage of a severe illness and medical treatments are no longer working. For these people, a physician would assess that their life expectancy might be 6 months or less if we don't treat that disease. So I know that's a lot of words and still difficult to understand, but there can be certain signs that it is nearing time to shift from that curative treatment that's very aggressive to comfort and a focus on the quality of life. Signs like your medical treatments aren't giving you the desired results anymore, increased visits to lots of doctor's appointments and maybe even the emergency room or stays at the hospital, and physical signs like weight loss and some body changes.
Misti, what is the role of the family and the patient in this decision?
So a lot of people say that their quality of life is more important than how long they live. An essential first step in the conversation around hospice is being transparent and having honest discussions about the kind of care we want. And we need to be talking to our families and our doctors about what this might look like for us. Similar to that, we as family members could start these discussions when we see that our loved one might be declining and becoming more tired from the care that they're seeking to treat these serious issues. When we do hospice evaluations, or even just educational visits out to families in their homes, it's always crucial to have those family members present and for everyone to engage in the discussion. With this type of health care, at its core is the patient and the family. So it's very important that we're all together and on the same page with moving forward.
Can hospice care begin at any point, or is there a right time?
So we have mentioned that the life expectancy of 6 months or less is something that's needed for hospice. That is a rule from Medicare, but there is also room for us to look beyond that when we have our patients who do approach that 6-month point. If they're still declining due to this disease, we can continue hospice care. Now, I start by saying that because often we hear a complaint as being that we wished we would have started hospice sooner than we did. There's a lot of research out there suggesting that patients who enter hospice care earlier will experience better comfort and quality of life during their final months. And this is because the patient and the family is getting that very central and meaningful care as we learn what's important to the family and, of course, to the patient during their journey. Hospice care is absolutely not only for our last few days or even weeks of life. It's a really valuable option for improving quality of life during the entire terminal phase.
Well, now that we know when it might be time for hospice, let's address some of the misconceptions people often have about hospice care. I'm sure many of our listeners have heard some of these myths, so let's set the record straight. Myth 1, hospice care hastens or causes death sooner.
So the goal of hospice is not to prolong life or hasten death, but to allow patients to live comfortably and peacefully for as long as possible during their final months, weeks, or days. Studies show that symptom relief, including pain management, does not hasten death, or actually in some cases it could even extend life.
Well, here's another myth. Starting hospice care means you're giving up.
No, absolutely not. Hospice care does not mean you're giving up. It signifies a shift to focus care from being curative to prioritizing comfort and quality of life during the final stages of a terminal illness. Choosing hospice care is actually a very powerful and strong decision, quite opposite from that myth.
Well, here's myth number 3. Hospice is only for people who have only a few days or weeks left to live.
It's for individuals with a serious illness, typically with that prognosis of 6 months or less. Hospice improves their quality of life and supports them and their families.
Myth number 4. The medications that hospice gives can cause a person to pass away quicker.
So this is a really big one. No medications that are given during hospice cause death. They make the journey comfortable and dignified, but they do not cause death to come sooner. When hospice is started late in someone's disease, many times their symptoms are not under control at all, which means that we do have to give them more medications than someone who might have started hospice sooner. So that, I think, is the root of that misconception, but those medications are powerful to get them to that comfort level.
Okay, here's myth number 5. Only a physician can refer a patient for a hospice care.
No, well, actually, you can refer yourself to hospice. We would contact your physician with your consent, of course, to obtain the records and start the process for when it is the right time. We would, of course, stay in touch with your physician if the decision is made to move forward with hospice care, but you do not have to have a physician refer you.
We've cleared up some of those myths that folks have, and I know that this has helped me and our listeners to better understand when to consider hospice and what it really offers. How can our listeners find out more about Hamilton Hospice?
Thank you for having me on the show. Hamilton Hospice can be reached at 706-278-2848.
That's 706-278-2848. Or you can visit vitruvianhealth.com/hospice for more information.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.